Okay, the next step and the last step in the examination of the neck is about to examine or check the vasculature of the neck in the form of carotid arteries and jugular veins. Let's take a look. First of all, we have to let's determine the carotid pulsation really by pressing here laterally with the left thumb over the transverse spinous processes of the neck. You will see and you will feel the pulsation of the carotid. After that, you have to detect the contralateral side, just like this. Do not compare both sides simultaneously. This may induce syncope. After that, we have to check for the jugular veins. First of all, we have to make the patient neck relaxed. If we have a look here in the neck, we have to know that we have here carotid artery and jugular veins, both internal and external jugular vein. First of all, make the head of the bed at 45 degrees from the horizon. If the patient had no visible veins, just like our volunteer here, you have to lower the head of the bed down. If the patient had elevated jugular vein well above the mandible, you have to ask the patient to even sit. This is first. After that, we have to inspect the pulsation in the neck to determine whether it is arterial or venous. Really, the venous had two peaks per a beat, while the arterial had one. The most prominent movement in venous pulsation is inward, while it is outward in carotid pulsation. After that, you have to palpate the left carotid of the patient and to see whether what you see here from pulsation, is it comes or coincide with the pulsation felt here. If it is so, it is arterial, otherwise it is venous. And when we would like to determine the venous pulsation here, between the clavicular and the sternal head here of the sternocleidomastoid, the internal jugular vein will appear from here and ascend till here. Really, this is the jugular venous pulsation, will be visible here. Lateral to it is the external jugular pulsation. If you are able to see the internal jugular pulsation, you have to take it as a measurement for the JVP. Otherwise, you can use the external jugular pulsation. Once you detect venous pulsation here, try to palpate it. If it is palpable, so it is arterial. If it is not palpable, it is venous. This is one of the maneuvers. After that, you have to obliterate at the neck root. You have to obliterate the pulsation, just like this. And to see whether the pulsation is obliterated or not. If it is not, so it is arterial. After that, you have to ask the patient for the cosmal sign to take breathe and take it and out. هذا هسه تاخذ نفس قوي. هي اقطع. ذبة قوي. اقطع. Normally, على راحتك. Normally, the jugular venous pressure will be elevated during expiration and lower during inspiration. The reverse is called the cosmal sign. After that, we have to warn the patient and tell him that we are going to perform the abdominal jugular reflex. بس حماد راح اضغط شوي على بطنه while we inspect the jugular venous pressure. Here we have to press the mid abdomen with our palm, thumb pressure for 10 seconds, and to see the jugular venous pressure for 10 seconds, and then remove your hands. If the jugular venous pressure is raised and then descend 4 cm with the withdrawal of the hand, this indicates positive abdominal jugular reflex. This test is designated to check the right side function of the heart. After that, we have to determine the upper limit of the jugular vein. For example, if it is here, for example, let's say, if it is here, how can we determine it? We can determine it. This is the top of the oscillation or of the pulsation, and you have to have a ruler from the sternal angle. Sternal angle is about 5 cm below the suprasternal notch. Here, a ruler, and to check, for example, if it is here, so it is about 5 cm from the sternal angle. You can comment upon the JVP that it is 5 cm above the sternal angle, or totally it is 10. Why? Because from the right side of the heart till the sternal angle, we usually give fixed value, which is 5 cm. So 5 cm plus this 5 cm, the net result will be 10 cm water, which is the JVP. After that, you have to check the jugular veins, which wave is apparent. Normally, the A and V wave is are the most obvious one, and we have to know the waves. How we can draw the waves of the JVP? Really, we have a simple skills here. First of all, we can write C V A. Really, this term is widely used in neuromedicine, but here it indicates the waves of the jugular vein, some of the waves. Between them, you can put here X and here Y. Just connect between them. This is the jugular venous pressure. Then you have to determine which wave or what are the waves that coincide with the systolic phase, and what other waves that coincide with the diastolic phase. Really, we can, if we put an imaginary lines here, this is the systole, the other occurs in diastole. How we keep them in our mind? X, C, and S for systole. All of them contain the pronunciation S. So C wave, X wave occur in systolic phase, while the V, Y, and A occur in diastolic phase. This is really about the how to draw or how to sketch the JVP waves. After that, you have to know the causes of the jugular venous, increased jugular venous pressure in general. You have to know the causes of giant prominent A wave or the canon A waves, the causes of V wave, most prominent V wave in the jugular vein, and X and Y, prominence of X and Y, for example, in constrictive pericarditis, or just the Y with the absence of X, for example, in patient with cardiac tamponade. And also you have to know the causes of the cosmal sign. All these about the examination of the jugular vein in the neck.